Welcome to the Injury Data Online Tool, or iDOT. This tutorial provides a brief overview of the 6 easy-to-use data tools designed to facilitate and simplify access to data for injury prevention stakeholders in Canada. Here you will find the Injury Death Data Tool, the Injury Hospitalizations Data Tool, Motor Vehicle-Related Injury Data Tool, Sports-Related Hospitalizations Data Tool, the Drowning Data Tool, and Poisoning Hospitalizations Data Tool. Once one of these tools has been selected, the main data selection page will be displayed. Within the Data Selection tab, a breakdown of sections will be visible, with each section displaying a heading. For example, within the Injury Death Data Tool, 3 sections will be seen: region and year, demographics, and cause of injury. Each section is further divided into data variables which allow the user to select the information required. The tool has been developed to allow easy navigation and minimal screen consumption. Therefore, all the parameters are stored under collapsible categories that will expand when selected. Let's take a look at an example using the following question. How many children ages 5 to 9 years of age presented to hospitals within the Toronto Central Local Health Integration Network of Ontario with injuries from falls on the ice or snow between the years 2007-8 and 2009-10? To determine this, firstly, select the Injury Hospitalizations tool. Like all of the tools, there are 6 main tabs along the top: Data Selection, Table, Graph, Glossary, Methods, and Disclaimer. The Data Selection tab is used to select the parameters related to the data we wish to understand. Select by region of treating facility, leave by fiscal year selected. Under region and year, within the Region tab, choose Health Region, and uncheck Canada to deselect all other regions. Scroll down to Ontario and expand all Health Regions options, selecting Toronto Central Local Health Integration Network. Under Region and Year, select the Year tab. Uncheck Year and choose the fiscal years that apply to our particular query. In this case, 2007-8, 2008-9, and 2009-10 should be selected. Under Region and Year, leave the Month tab per the default, since all months are automatically selected. Under Demographics, select the Age Group tab, uncheck Age Group, and choose the desired age group, in this case 5 to 9 years of age. Under Cause of Injury, the user can choose a specific intent, cause, or subcause of injury to further narrow the desired data. For our purposes, select Subcauses and expand the options located under Unintentional Injury, then Falls. Select the option Fall involving ice and snow. Leave all options under Type of Injury, Injury Location, and Place of Occurrence per the default. The option is now given to select which way we wish to have our data presented, either by number of hospitalizations, by rate per 100,000 population, or by age standardized rates per 100,000 population. Since we want the number of cases, we will be sure that number of hospitalizations is selected. Under Broken Down By, select Age Group and None. This will display the total number of cases. We can now click Submit to receive a summary of our data. A summary of the selected parameters, as well as the date and time of your search, will appear before each outputted table and chart. This allows you to verify your selections. Results may be exported either in Excel, Word, or as a text document. If you would like to see the information in a chart, then click the Graph tab at the top of the page. The Glossary tab provides a description of the various terms used within the iDOT tool and can provide further information on how to narrow the desired data. The Methods tab provides further information on how the data is assembled. Please ensure that you click the New Query button located at the top right of the page before beginning a new search. As a default, we have ensured that all boxes are checked within all selections, which allows iDOT users to look up data from the entire dataset. When you decide upon and submit your query, the output tables will only display the data for those boxes that you have selected by checking and/or unchecking the boxes. There are two main levels to most of the data presented, and a further two sub-levels for some categories. The first level is an aggregated version where data are presented as a group. The second level provides additional detail. All further levels can be accessed by clicking the plus button beside the text. This option applies mainly to greater detail related to the region and to the cause of injury selections. There are two main types of output options: numbers and rates per 100,000 population. Rates are only available by year, age group, and sex, and a selection needs to be made in order for rates to be calculated. For example, a rate can be calculated if you are interested in hockey injuries by year or falls by age group and sex. If a rate cannot be calculated, you will receive an error message on your screen. Age standardized rates are also available as an option. This is relevant when comparing rates between boys and girls, for example, disparate geographic regions or populations, or over time periods. The output for your selection can be viewed as a table or as a chart. You are able to select what your output will display using the drop-down options and then submitting the request. While this tool provides a detailed and in-depth summary of injury data, you can also use the Injury Data Dashboard in order to visualize the data from the same data set. To see the corresponding dashboard, click here. Or, for more information on how to use the iDOT tool, click here. Thank you very much.